At ProHealth, we truly believe that hospice care begins with compassion. It's about dignity, always. And most importantly, it's about the promise that no one, absolutely no one, walks this journey alone.
Hi, I'm Lydia.
I'm Stephanie.
And we are the Savvy Hospice Chicks of ProHealth. The gift of hospice really, we don't just service the patient, but we also service the entire families. As our team is coming in, we really want to know what the family dynamics are, how we can best support you in this very vulnerable time that you're in.
One of the patients' wishes were to go back to their country and to pass away in their own country. We worked as a team to make that happen, whether that was writing letters in order for this patient to board the plane, have oxygen, and then be safely transported to their country so that we could carry out their wishes.
There is a myth about hospice that as soon as you come on hospice, once you get that prognosis of 6 months or less to live, that's literally all you have with your family member. With Medicare, you have unlimited hospice benefits, so there's no time that you're like, oh, we have to end hospice, unless they get better, which some families do, and they no longer need hospice at that time because it's not something you have to stay on.
Hi, I'm Odessa. I'm a hospice nurse for ProHealth. Personally, for me, hospice nursing is providing support spiritually, emotionally to patients and family, helping them transition and live their life peacefully.
Hi, my name is Hayden Asbury, and I'm here to discuss the ProHealth Hospice services that my mom was on. It was an amazing support, not only for my mom, but for my family, and to help guide me through the process. And one of our regrets is that we wish that we would have done it sooner. It provided my mom so much freedom. It was during a time when my mom, she couldn't really speak, and it was during her last few days, and we did not know what to do, and so I was able to call the on-call nurse, and they were able to come out, help support. She was actually able to be comfortable, take a big deep breath, and be able to relax a lot more. And I feel like I'm very blessed because my mom's passing was so angelic. As weird as it is, it was so angelic and peaceful, and I feel like it was because of the resources that we had at ProHealth.
Hi, my name is Kevin Simrin, and I'm a ProHealth Hospice and palliative social worker. It starts with just the mission of having quality end of life. But a lot of times that means I need to go there and dispel all the bad things they felt about hospice, that hospice hurries up the end of your life. Nothing could be further from the truth. And I remember a doctor talking in a hospital bedside with a patient that was scared to go on hospice. And he said, a lot of times people feel better when they're on hospice. They don't realize you start to, as close as you can to do of your thriving self.
At ProHealth, we believe hospice should be aligning with your goals of care and living with dignity and comfort. As medical director, every morning when I walk into the office, our entire team has only one goal in mind: to take care of the patient. And because of that, I think any patient that comes on the service with us at ProHealth will get the right care that they need.
The role of hospice in a residential care facility is to be a support. I'm a proactive person, so what I really appreciated is that ProHealth is also very proactive versus reactive. I'm being heard. As the owner of a care home, I feel like they're listening to me, they're hearing what my concerns are, and then they are trying to find a solution that works for everyone. Vibe is exactly what I think my families need. Their touch. It's a very genuine touch.
As a hospice team, we really come together and work for the family and the patient to make sure that they're taken care of. We are 24/7, and patients and families can get in touch with us whenever they need us. Comfort measures might happen, med management might be needed. Having that team around you when you need it the most is super important.
I think it's important when you're making a decision for what the best hospice is for your loved one. It's always important to consider what that hospice's values are. A lot of hospice agencies, they don't come with heart, and I think that when you look at agencies like ProHealth, they definitely look at heart as part of their core values.
Our volunteers, their services are very individualized, as is all of the services in ProHealth Hospice. There's never any two hospice patients alike, and that also carries over into our volunteer department. We may have a patient or a family that wants someone just to be sitting at the bedside. We may have someone who really enjoys nature, outdoors, and they love wheelchair strolls. We also have patients that like to get their nails polished. It can be about watching movies. It can be about reading a book. I had a volunteer with a blind patient. Their age difference was incredible, but the volunteer went in and ended up reading the entire book of Heidi to the patient from start to finish.
My name is Ronan Rances. I'm the chaplain and at the same time also the bereavement coordinator of ProHealth Hospice. As a chaplain, my number one role is to journey that faith and really to be with the family. By the way, when we say ProHealth, we are non-denominational, meaning to say we cater to any kind of religion. There is love and respect in ProHealth. Hospice, it's not an easy experience, but when you have ProHealth embracing you, that's something like we care for you because you are a family to us.
To learn more about hospice or to speak to one of our hospice care consultants and schedule an evaluation, please contact us at 8779-776432 or visit our website at prohealth.us.